Welcome to the eClinicalWorks podcast. I'm your host, Brian Hughes. This is a very special podcast as we are joining from the 2020 eClinicalWorks Virtual National Conference. On today's podcast, I'm joined by Dr. Amar Shah of VitalCare Family Practice, a 3-provider group based in Chesterfield, Virginia, that provides primary care. Dr. Shah, thank you for joining the podcast today.
Brian, thank you for having me, and thank you for letting us share our story.
Absolutely. Now, Dr. Shah, you've been one of eClinicalWorks' success stories in recent months, describing some remarkable experiences using eClinicalWorks telehealth. How are things going currently with telehealth with your practice?
They're going great. We currently have dedicated time each day for televisits. It helps me sort of structure my day and my workflow more efficiently when I actually have dedicated televisits each day. My patients love it because there's still a lot of fear around the COVID-19 pandemic. And there are other ways that it's definitely improved or lifted some barriers of care to my practice.
Now, one topic, especially during COVID-19 is the topic of behavioral health. And I understand that you and your group have taken an active approach with your patients when it comes to behavioral health. Would you be able to share some more information around your approach?
Sure. So we all understand that behavioral health is a big part of primary care. There's a shortage of behavioral health care providers, and many times primary care has to do the evaluation and the prescribing and the monitoring of those patients. What we also noticed was that many of our patients who have behavioral care health issues have high utilization in emergency rooms. When we saw those numbers, we were astounded, and many of those patients recurrently go to the emergency room for physical conditions such as chest pain and headache and abdominal pain. But what happens in the ER is that they only address the chest pain and the headache and the abdominal pain, and the behavioral health issue is not usually addressed. And so 9 times out of 10, recurrent ER visits usually have something to do with the behavioral health problem. So we wanted to take a proactive approach by reducing our unwanted ER visits and providing direct behavioral health services here from our providers and care managers and therapists in the office.
Now, you're really taking a focus on providing that overall quality of care with your patients. And I understand you're undertaking a in-house study somewhat between that correlation between behavioral health and ER readmission rates.
Mm-hmm.
Can you shed a little light onto that?
Sure. So we certainly have preliminary data on high ER visits and untreated behavioral health conditions, along with some large or major comorbid conditions such as diabetes and hypertension. Anecdotally, in my office, since we've started the program about 6 months ago, we've noticed just improvement in diabetic management and hypertensive management in those patients who are currently in our behavioral health care program. We've also seen better adherence to medications with their antidepressants and anti-anxiety medications, and we've also seen better follow-up in the office.
That's great. And you mentioned follow-up in the office, and it isn't easy all the time to reach your patients, especially ones that need the most care regarding their physical and mental health. How have you used eClinicalWorks Messenger and campaigns to reach out to your patients? And are you able to share any examples with us today?
Sure. So we currently have some campaigns active for diabetes management and preventative services. But we decided to also have a campaign for follow-ups for behavioral health conditions such as depression and anxiety. Many patients tend to forget that they have a behavioral health appointment with our care manager, even though we have a telephone message, an email, and a voice message going out to them. So we have a portal message now that gives them a notification 1 week, 3 days, and 1 day prior to be sure to follow up. We've had to take an additional proactive approach by cold calling a lot of patients 2 days prior to be sure that they still should be coming to the office, or we do offer virtual care as well for behavioral health services.
Now, you've taken a big step with your online process, with your website. And would you be able to share some strategies in establishing that online presence, and has it attracted any new types of patients?
Sure. My practice is relatively new. It's about 3 years old, and we wanted to make sure that our online presence was fairly strong. And we've invested a good amount of money on marketing, and our marketing includes an up-to-date website with good content, along with refreshing content for patients with issues such as getting your flu shot or providing education around getting better sleep. So, and then we also have the ability to have online appointments on our website, and we encourage all our patients to be on the portal to engage us beyond the telephone. We also have had significant marketing along our social media platform, such as Instagram, Facebook, and Twitter. So by combining all of that sort of online presence, we've truly been able to capture a large demographic of patients in our area that would not have normally found us.
And talking about that modern technology and attracting patients, and some of it involves technology that is useful and easy to use for their patients. One of which being HiLo Checkin, which is a fairly new feature that has received a fair amount of attention as of late. Has your office workflow adapted to this new type of technology, and how are the patients responding to it?
So we are excited about HiLo Checkin. We would like to implement it. We are in the process of implementing it now, but we would be committed to doing that just because so many patients now don't want to sit in our waiting room to check in. They want to sit in their car to check in. I think that's going to be a great addition to our practice.
Yeah, and there's been great feedback regarding it. So it just streamlines that process. So I'm glad you and your practice is taking up on that technology.
Yeah.
Well, Dr. Shah, thank you for joining our podcast today, and I hope you enjoy the conference.
Brian, it's always my pleasure to give my feedback and tell our story. I just want to thank eClinicalWorks for always giving us a platform to tell our story and to help other providers and practices.
Well, thank you, Dr. Shah, and thank you for joining and listening to our podcast today. You can find more podcasts like these on our website, eClinicalWorks.com, on our support portal, iTunes, and YouTube. On behalf of the eClinicalWorks podcast team, thank you for joining today.